Our next presentation is entitled APSA Members Experience Bias and Discrimination in Training and Practice. This will be presented by Dr. Vernamonti from the University of Michigan.
Thank you for allowing us to present our work. We have no disclosures. Workplace bias and discrimination is well documented and prevalent in general surgery training. 80% of women residents report gender-based discrimination, and almost half experience episodes of sexual harassment. 70% of Black residents, 46% of Asian residents, and 25% of Hispanic residents also report workplace bias and discrimination. This leads to burnout, mental health disorders, as well as an increase in medical errors. And bias and discrimination can come in many forms and from many settings. Even though there's extensive data in general surgery and general surgery training, it is important to directly study our own profession and to address the knowledge gap within pediatric surgery. It's important to include everyone, as well as to assess multiple places in which bias can come, including professional societies and organizations. And also to include identities such as practice settings and academic ranks, given how diverse and broad pediatric surgery is. The purpose of closing this research gap is that it can be difficult to advocate and institute change when you're basing this change from extrapolating data on other populations. And so we hope to show what we can do with our own specialty. Our hypothesis is that bias and discrimination would be prevalent within pediatric surgery and that it would disproportionately affect different identity groups. To address this hypothesis, an investigator-created survey was anonymously distributed to every APSA member, of which 423 responded for a response rate of 27%. Now, while 27% is low by other standardized survey criteria, it is one of the largest response rates and absolute number achieved through the Outcomes Committee. Also, as you will see, the relative representation across identities, practice types, and academic ranks is broad, and we believe that the results are generalizable and serve as an adequate sampling for members' experience with bias and discrimination. The scope of the questions asked were bias experienced within the workplace, the APSA organization, committees, and comfort reporting these instances to APSA. For the demographics of respondents, 64% identified as men, 97% were heterosexual, 75% identified as white, 13% of members identified as Asian, and 5% identified as Black. For practice demographics and academic rank, there's a fairly even distribution across academic titles. 69% practiced in an academic setting, 21% in a community with academic affiliation, and 10% in a community alone practice. Shown here is the absolute number of bias reported across the top by different identity demographics. What's important to note is 31% of all respondents reported experiencing bias within their primary workplace. 56% of Asian members, 55% of Black members, 42% of Hispanic members, and 60% of women members reported experiencing this bias and discrimination within their workplace. The distribution between identities when looking at bias within APSA and committees was not as notable. However, 12% still reported experiencing bias within the organization and 7% within the subcommittees. And strikingly, only 47% felt comfortable reporting these instances if they experienced them to APSA, with only 27% of Asian members, 32% of Black members, and 37% of women feeling that they were able or comfortable reporting these instances to APSA. To separate out the different contributions of identities, we did a multivariate analysis. Shown here are the odds ratios of experiencing bias in the different settings compared to majority demographic references. Asian members and Black members were 5 times as likely, Hispanic members 8 times as likely, and women members almost 9 times as likely to experience bias within the workplace compared to white or male members. Additionally, Asian members and women members were less comfortable in reporting these instances to APSA. When looking at training and academic settings, trainees were more likely to experience workplace bias when compared to professors. If you worked in a community with academic affiliation, it was protective of experiencing workplace bias. And those that reported working in a community practice said they increased experience with bias within the APSA committees. In conclusion, bias and discrimination does remain prevalent within our organization and within the workplace today, and it does disproportionately affect different identity members. It is important to acknowledge that APSA is leading other national societies and encouraging and talking openly about bias and discrimination that is experienced within its own organization and directly looking at how to solve and address this going forward. And APSA can continue to be a model for other professional society organizations. We present this data as an opportunity for all of APSA and the APSA members to initiate and shape and tailor the change that best suits the members, to keep leading in how we can protect each other, and to continue to lead in children's surgical care. Thank you very much, and I'm happy to take any questions or comments.
Thank you. We'll now open the floor for questions for 4 minutes. I have one question, and this may not have been asked, but or did you get a sense for who was discriminating against the people who responded? Was it from faculty, fellow residents? You know, I know you said the trainees was a pretty high amount. Was it staff? Did that come out in your survey?
Yeah, so the survey didn't specifically ask the source, but there were sort of comments and qualitative data, and it was pretty broad. It was from ancillary staff, it was from patients, it was from other specialties, hospital administrators. It was a pretty broad source within the workplace. And we didn't specifically ask what and why within the organization, which is sort of a little bit of a limitation.
That was very nice. Thank you, Andrea Hayes from Washington, D.C. Can you take this opportunity perhaps to share with our membership the DEI committee's efforts to address some of the concerns found in this survey and what the committee is doing for APSA in this time based on the fact that this is, since the pandemic is a fairly new committee to most of our APSA members. Just a minute or so for the membership.
Sure. Well, I will say that this information has also been presented and fairly well received to the board of directors, and appreciate all of that, as well as the council of chairs. And from the DEI committee, I don't want to go too far in case this is going to be presented by someone else, but there is a toolkit that they are working on as well to start implementing DEI awareness and initiatives at people's workplaces. I don't believe it's fully complete yet, but they are working on an entire it's going to be a free, accessible toolkit for that.
Andreas Meyer, not sure whether you can hear me okay. SUNY Upstate. I think what you measured is actually the impression of bias, which may most likely be real. What do you think of a follow-up study, do a qualitative study to actually look at what the bias looks like and see whether that gets a little bit closer to what really needs to be done to make this better?
Yeah, thank you for your question. Yeah, I completely agree. I think this was initially, it was designed to look at the sort of broad experiences, but there were a couple things that I think are important. We first only looked at the comfort in reporting to APSA, bias and discrimination within APSA. We didn't address all of the issues within people's individual workplaces and looking at sources. It's going to be somewhat institution specific, but helpful for everyone's hospitals to sort of be aware and internally kind of self-diagnose to see what the avenue for improvement is going to be.
Hi, Mohammed Imran from Corpus Christi.
Hi.
So this is great, but it's a snapshot in time. Do you have any historical data to compare? Where were we? Where are we now?
We have, no, not on this. My understanding is this is the first that we've really assessed within pediatric surgery, and most studies showing this workplace bias is really done in trainees. So extending this to a mostly attending demographic, and to do this, we don't have historical data on the bias and the trend that we're going, but this is as of 2021. So we are still in a place where 30% of members are experiencing bias and significantly disproportionate based on your gender and sort of race, ethnicity, identities.
Thank you.
Thank you.